Hello. This is very strange for me to go on live like this in the middle of what is undoubtedly the busiest work day of my week. So I very quickly touched up my face, threw on some makeup, and here I am. So something came up over the course of my day, and it was a bit of an aha moment. Um, so I talk a lot with Nanyi, Mateo about remote interpreting. We've had things on this channel talking about remote interpretation, and I really have opened my mind and started thinking about, okay, well, how does what I'm doing as an in-person medical interpreter relate back to remote interpretation? So something that came up today that was really interesting and eye-opening to me was, well, listen, I do a lot of developmental pediatric interpreting. So I'm interpreting for occupational therapy, speech therapy, sometimes physical therapy, feeding therapy, what have you. And typically, this is for kiddos who are between the ages of 0 to 5. However, that age range is a little bit flexible. Something that has come up, and this is kind of the tagline of this video, what do remote interpreting, so over the phone and video remote interpreting, what does that have in common with in-person developmental pediatric interpreting? And it has to deal with auditory processing. So when it comes to interpreting, we are doing a lot of things with our brain, right? We're thinking, we're interpreting, we're translating in our mind from one language into another. So, Alexandra, I'm an independent contractor, so I'm not actually an employee of any company. But I do, goodness gracious, about 99% of my appointments these days are with it's pediatrics, developmental pediatrics, ever since COVID. But when it comes to interpreting for, like, let's say speech therapy, if a kiddo is not 100% intelligible, if, let's say, they're not articulating well, if they are not, if their words don't make sense, if they're not stringing together correctly, this reminds me a lot of what it was like when I was interpreting over the phone. Because when I was interpreting over the phone, we often had issues with audio quality. And also over video, the connection quality would determine how the audio quality. So if you have poor audio quality, or if you are interpreting for let's say speech therapy, or even occupational therapy for a young child who has issues with expressive language, so that is being able to express themselves linguistically, the more unintelligible the speech is that you have to interpret or have to be attending to, the higher your cognitive load. So if you're interpreting remotely and the audio quality is poor, it's going to increase your cognitive load. So I have a little diagram here that I made before I started. It's probably reversed, but as intelligibility of speech goes down, whether it be because of expressive language issues or whether it be because of audio quality when you're interpreting remotely, your cognitive load as an interpreter goes up. And when your cognitive load as an interpreter goes up, your accuracy can be affected and your accuracy can go down. And I experienced this. I feel like I'm normally pretty on the ball, not to toot my own horn, but I'm encountering that as I am interpreting more and more for children with speech, expressive language concerns or impairments, the more I'm thinking, the more I'm having to listen with a keen ear. And the less accurate my interpretations are if they are not split up into multiple short utterances. Now, to put this into context here, typically when I'm interpreting for developmental behavioral pediatrics, I'm interpreting not just for the child, but oftentimes for the parent and the therapist. So if the therapist is interacting with the child, I have to interpret that interaction. If the child is expressing something, I have to interpret it if it is intelligible enough for me to understand. And sometimes that's a difficult thing to determine. I'm also interpreting for the parent. So if the therapist and the parent are conversing, I have to interpret between that. If the parent is saying something to the child, I have to interpret that. So it gets really, really complex really, really quick. I'm already, for managing the flow of communication, it's already a lot on my cognitive load. And I think this is why the research that Andrea Henry is doing on interpreter fatigue, mental fatigue, is so important, because there are so many different things we do as interpreters that place a burden on us cognitively. And listen, it's like you have a piece of pie, right? You have a whole pie. And if you're taking out a slice of that pie to manage the flow of communication, to kind of remind everyone, okay, this is how this needs to go. And in the case of children, having to really decide, okay, who am I going to prioritize interpretation for at this moment? Because this child does not understand turn taking. So I have to really switch in high gear and interpret for that child. That takes a slice of pie out of my cognitive pie. If I am interpreting itself takes a couple of slices out of that pie. If there are children crying, that takes a slice out of that pie. If I am having to crane and really, really put an attentive ear to what someone is expressing because they have an expressive language impairment or delay, that's another slice out of that pie. And what ultimately ends up happening is the more cognitive load that we have doing the tasks that we do as interpreters, the less we have, the less slices of that pie we have to really focus on interpretation. And that just made me think of remote interpreting and how there are so many demands on the remote interpreter. There are so many things that you have to manage, the customer service aspect of it, transferring calls, sticking to the proper procedures in the flow of the call, things like that, which is why I made flow charts when I was doing remote interpretation. All of that, it takes those slices out of that pie being our cognitive load and our cognitive capacity, because our brains aren't limitless. We only have a select amount of cognitive energy that we can dedicate to any task at one time. So I've noticed that there's this issue with me personally while I'm interpreting. The more unintelligible the speech becomes, the more my cognitive load increases and the lower my accuracy can go. So this is something that a lot of remote interpreters experience as well. I try and empathize as much with remote interpreters as possible, because these are the realities of our profession. These are the realities that we have to recognize. And sometimes putting words to it, sometimes, just thinking about it and opening your eyes up to this possibility can really, really help you to come up with strategies to manage it. So when I have those instances where I am interpreting for someone whose level of expressive language, their intelligibility is compromised, and I'm having to listen more intently to what that person is saying, whether it be a child or an adult, because I've definitely had adults I've interpreted for where their intelligibility is compromised. What I try and do is then switch to third person and then remind the provider, anything that they say, or the parent, anything that they say, if they could split it up into shorter phrases for me, because then I can manage those shorter chunks. Whereas normally when I'm interpreting, I can manage a pretty long utterance consecutively without taking notes. But the second we introduce that intelligibility component, my ability to interpret those long utterances decreases drastically. And I've gotten pretty good at understanding kiddos and their baby talk. I've gotten to be like an expert at it. I'm really good at it. I'm not to toot my own horn, but we all have our limitations, right? And today was one of those days where my limitations were kind of pushed a little bit. So recognizing your own limitations, recognizing just how our brains work when we're interpreting, and not just narrowing yourself into this box of thinking of, okay, I'm an in-person interpreter, so these are the challenges that I have to face. also thinking like, okay, well, how would this play out in remote interpretation? Because oftentimes we are not limited to a single mode or medium of interpretation. Oftentimes we're doing multiple. So we just have to keep our minds open and always keep on pushing forward and always keep on striving. So that's it for that little tidbit today. I know I have a couple of folks watching. I just wanted to make sure if anyone had any questions before I popped off. Yeah, today, Mondays are absolutely, I feel like a chicken with my head cut off sometimes running around on Mondays because I have so many appointments. But I'm in my office for like another couple of hours. I had an appointment that was canceled, so we'll see. But with that, I don't see that I have any questions. But if anyone has any additional questions, you can always comment on this video, and then I can go back in and answer those questions later. And some key terms from this video, we have intelligibility, auditory processing, so your ability to actually process the things that you hear, cognitive load, so that is basically your the amount of energy that you're expending cognitively with your brain. And yeah, so those are a bunch of things that I talked about. So thank you for watching, those of you who tuned in. I know it's kind of random for me to do one of these videos, but Nanyi does them all the time. And so I figured, you know what? This is a really, really good topic to do one on. So with that, have a good rest of your Monday.